Welcome to the Vanishing Veins online demonstration. Do your legs ache and feel tired from varicose veins? Would you like to improve the appearance of your legs and get rid of unattractive varicose and spider veins? Let us show you how, without painful surgery, without lengthy recovery, without an expensive hospital stay. What are varicose veins? A varicose vein is a failed vein, one that does not efficiently carry blood back to the heart after circulating throughout the body. The valves in the veins don't work properly, leading to pooling of blood in the veins, causing them to expand from the pressure. The result is the characteristic appearance of enlarged, twisted veins, often visible in the legs and feet. How does this happen? Normally, stop valves in the vein close to keep blood from circulating downward with gravity. When the valves become weak and don't close properly, they allow blood to flow backward or reflux. Varicose veins that have lost their valve effectiveness dilate under pressure and become twisted, bulged, and thickened. Pressure from the pooling of the blood causes swelling and discomfort in the legs. What do varicose veins look and feel like? Varicose veins typically appear bulging and rope-like. Other times, they are small and thready, visible to the surface of the skin. Varicosities often lead to aching, tired, and swollen legs, create a burning, throbbing, or itching sensation, and cause muscle cramps and a general restlessness in the leg. This condition worsens with time. How often do varicose veins occur? Varicose veins affect 1 out of 2 people age 50 and older, and 15 to 25% of all adults. They occur more often in women. In fact, approximately 80 to 85% of all people who receive medical treatment for varicose veins are women. What causes varicose veins? Most patients who suffer from varicose veins have a family history of the condition. Another factor is hormonal changes that specifically affect women. Pregnancy further increases the chances of developing vein disorders. Other contributing factors include prolonged standing, being overweight, and/or having had trauma to the leg. Severe varicose veins can compromise the nutrition of the skin and lead to eczema, inflammation, or even ulceration of the lower leg. If I don't see ropey veins on my legs, is it possible they are still there? People without visible varicose veins can still have symptoms. Symptoms can result from spider veins as well as from varicose veins because in both cases, the symptoms are caused by pressure on nerves by enlarged veins. The best way to know the extent and location of the problem is by ultrasound exam. What kind of testing would need to be done to detect varicose veins? A physical examination and venous ultrasound are performed to assess the venous anatomy, vein valve function, and venous blood flow changes. This will help to determine if the patient is a candidate for a laser treatment known as EVLT. State-of-the-art technology using ultrasound provides painless, non-invasive diagnosis. What are the treatment options for varicose veins? Endovenous laser therapy, also referred to as EVLT. This is the latest advance in treating varicose veins using an intense light source to the targeted area. Laser treatment has proven to be 97% effective. Therefore, you should experience no reoccurrence with the veins that have been treated. Endovenous radiofrequency ablation therapy. This is a technology of the past and is less successful than the newer laser approach. Surgical ligation of the veins. The documented failure rate for surgery is 30 to 80% in 1 to 5 years. What is endovenous laser therapy? The vein that causes most of the symptoms and unattractive appearance of varicose veins is a very straight vein on the inner aspect of the thigh called the greater saphenous vein. Using endovenous laser therapy to treat this vein is performed by numbing an area near the inner knee. Through a needle and introducer catheter, a laser fiber is inserted and advanced into the vein. Under ultrasound guidance, the laser fiber is positioned at the junction in the vein near the groin. Anesthesia and fluid is then placed around the vein so you don't feel the heat from the laser. The fluid also serves as a thermal barrier to prevent the laser's heat from damaging surrounding tissues. When the laser energy is turned on, it produces heat on the inside of the vessel that, when pulled back slowly, essentially zips shut the incompetent vein, scarring it closed, making it vanish.